I think, new methodologies coming forward are going to benefit us all in the future. I guess my real concern is if a member is not participating in the way that should be expected, not only how do we call them out in a way that might get them to behave as they should, so my question would be, do we say, well, you can't be part of the WHO if you're not going to adhere to the rules, or is there some enforcement mechanism? I don't know where to turn on that if it were to happen again in the same way. And I don't know if, so I'd love to hear your ideas as you deal with the WHO and the frustration that everyone had.
So I will try and respond to this question, Mr. Chair. Again, it's a good one, especially because we need everyone to be good actors around the table. One of the things that we are able to do as board members of WHO is at least track that very level of accountability and really understand how we all come together to support the work of the organization. As it turns out, we are board members alongside the Chinese government as well as other actors like Syria. And so it's one of the reasons why we want to remain at the table, if nothing else, to be a voice in that room and ensure that that voice is rooted in science and in the important work of WHO really serving not only America but the world in ways that we want to see.
Chairman, I agree with my colleague that we have to be at the table all the time and exercise our leadership, because it is by being at the table that we rally our friends and allies to put pressure across the board on countries that may not want to cooperate fully. We know that when we are not at the table, others will take our seat at the table. I think we have to always be at the table and continue to put pressure on it. The administration has been very clear on this, that we have to work in the area of global health security. We must work with people that we agree with and with people that we do not agree with, because we just don't know where the next threat will come from. And the way to do that is the platform for that is WHO. I can't think of any other platform that we should that could serve that role. Now, the burden is on all of us, the burden of leadership, to continue to put pressure on WHO to reform so that it can be more agile, it can be more forceful, and it can be more accountable in responding to or putting pressure where it's needed so that countries can be more transparent in their reporting.
I'll only add a couple of points to my colleagues. One is that we want respect for our sovereignty, and so we also limit how much WHO can control or demand things of us. And that is one of the challenges here, that we are protective of our own sovereignty and therefore do not want to have those tools challenged, potentially challenge us or other member states. The second point about possibly, well, then could we force out a China that does not adhere? And we want China under the tent. Once a country pulls out, they become a blind spot in our national security. Currently, China does participate as a network of 129 countries that submit flu and other illness data. It's the reason we have an effective annual flu vaccine, because we have access to information being supplied through those means. And so we want to have China continue to be a joint actor in this work. And so that leaves us in a space where it's diplomacy. Now, the additional reforms that the U.S. is advocating for under reforming the international health regulations are to make a clearer tiered response. Right now, we just have a public health emergency of international concern, and that's the declared level. And we're looking for a 3-level set of tiers so that there is an earlier indication that countries have a health issue developing of concern. There are clearer standards about what transparency requires, and then clear requirements that WHO has to live up to for reporting, making public, and indicating when countries are not adhering to those. So that set of commitments are a part of what we're aiming to negotiate and produce in strengthening international health regulations and the pandemic accord.
Well, I would also like to see something where the host nation, in this case China, doesn't get to decide who the United States sends and doesn't restrict who we send. Because frankly, I'd have been very pleased if any of the three of you were there when that occurred. With that, I yield back, and I now recognize the ranking member for questions.
Thank you. As ranking member of the Select Subcommittee, I've long called for a forward-looking approach to preventing and preparing for future public health threats that applies the lessons that we have learned from the COVID-19 pandemic. Emerging public health threats are not bound by our borders, meaning that this objective is as important for our engagement with the international community as it is for our domestic efforts. Reforming the World Health Organization to insulate it from political pressure and strengthen the international community's response to emerging public health threats is central to this mission. So I'd like to begin by asking each of our witnesses, with respect to the United States global health engagement in reforming the WHO, what is the single most important lesson that we should take away from the COVID-19 pandemic? Let's start with you, Assistant Administrator Gawande, then we'll move to the left.
Thank you. Number one lesson from COVID, I think, is that in crisis, U.S. leadership is indispensable. First, we are often the first in, and then we bring others along. A case in point is the U.S. providing more COVID vaccines without charge than any country in the world, with 700 million vaccines. But then we also supported COVAX as a mechanism that then got other countries to do their share. We came in early with funding first, but the net contribution of COVAX was even larger in the end. There are multiple other examples in the ways we led on oxygen capacity and building that out in places that didn't have capacity for oxygen in the face of a respiratory virus, around antivirals being distributed. American leadership works because when we lead, we pull in partners and allies with us. We demonstrate the values of global collaboration and harnessing collective national security. And American engagement with the WHO has been essential to our effective global response as a result.
Thank you, Ambassador Nguyen-Ngoc.
Thank you, Congressman. I think the number one lesson from, I believe, or one of the lessons from the COVID-19 pandemic is that a disease threat anywhere in the world is immediately a threat in the United States. It took only 2 months for COVID to spread to 165 days, 2 months. On January the 4th, there were just about four countries in the world that had reported COVID. But by March 20th, about 165 countries had reported COVID. So it tells us the story of our common connectivity, a common vulnerability, and the inequalities or inequities that we have to address. In all of this, I think the lesson that follows from there is our leadership is important. Our leadership in making sure that we are engaged, proactively engaged, so that such a threat, when it occurs and anywhere that it occurs, we squash it before it becomes a threat in the United States.
Thank you. Assistant Secretary Pace.
Thank you, Ranking Member Ruiz, for this question. My colleague, Assistant Administrator Gawande, touched on the importance of the international health regulations. And when it comes to lessons, I think we can think of it in a couple of different ways. First, as he mentioned, there are ways that we as HHS are working to amend those international health regulations, not only through the alert system or improvement of that system that he described, but also thinking of ways to give WHO flexibility to share the information that they see or receive by other means. So I believe the chair as well spoke to the limitations with regards to countries if and when they choose to be transparent with us. In the event they are less than transparent with WHO, WHO actually has other means to understand the situation, perhaps by other sources or other publicly available information. but they might hesitate for fear of backlash from that country if they get ahead of them. And then that country essentially retracts and isn't a partner in the response, or otherwise continues to be more opaque in what they share or less than forthcoming. And so what we're hoping to do also through these amendments is make it so that WHO has permission, so to speak, to notify other countries around the world if and when they give certain actors a chance to provide what they know, and those actors just don't respond. We just essentially don't want to be in the dark, and that's why it's so important to work in this way on these IHRs.
Thank you. The State Department and Department of Health and Human Services have also been representing the United States in the ongoing pandemic agreement negotiations, which are generating recommendations for member states to promote cooperation on preventing, preparing, and responding to future pandemics. Ambassador Nguyengasong, what steps is the State Department taking to advance the United States' interest in global health leadership in the ongoing pandemic agreement negotiations?
Thank you. The State Department is working very closely with colleagues from the Department of Health and Human Services to support our team, negotiating team in Geneva. And it's very clear, as you rightly said, that we need this instrument, pandemic accord or pandemic agreement, that would protect us. I mean, if you ask me to summarize that in one line, I would say it is an accord that will do the things that we have been discussing here, which is allow us to dictate early, respond early, to a threat that will emerge and invariably will emerge, because we all know that we live in an era of pandemics. So we're actually looking at ways we could continue to work with several countries, more than 190 countries around the table negotiating this. It's not a fast process, but it's a necessary process. We have to be at the table and continue to show leadership in the way we work with countries to share sequences, share viruses when the threat arises, and share, of course, the medical countermeasures. I think that is central to our ability to protect ourselves. Imagine if a virus or an unknown virus emerge in anywhere in the world where we don't have access to that. I mean, we rely on this kind of an accord or agreement to have access to those specimens, sequences, so that we can develop a diagnostic test, vaccines, or therapeutics.
Assistant Secretary Pace, how will the framework of the recommendations in the pandemic agreement apply lessons we learned from the COVID-19 pandemic to advance international pandemic prevention and preparedness?
Well, certainly, this potential agreements would do quite a bit to complement what is already in place, such as the international health regulations. One of the shortcomings, unfortunately, of the COVID-19 pandemic is it did not allow for a high degree of accountability when it came to accessing innovations in particular. And one of the things we are trying to negotiate as part of this agreement is to ensure that those innovations reach everyone, including Americans, on time. As the ambassador mentioned, that involves sharing samples and data so that we can actually produce or manufacture these innovations. In other words, spur R&D, essential R&D. But then there's a question of how these innovations reach people around the world. That isn't just a moral question, but it's a strategic one, frankly. Because in the absence of vaccinations, for example, we had the opportunity for variants to emerge. And thus kept us in this ongoing fight against COVID. So it's our hope that this potential agreement helps to, again, sort of buttress what we are able to do at a more technical level with regards to pandemic preparedness and response.
Thank you. And as negotiations for the pandemic agreement have been underway, there have been some misrepresentations of how this treaty would square with the United States sovereignty. Ambassador Nguyengasong, could you please help us understand, correct the record regarding these misinterpretations?
Thank you, Congressman. Let me say up front that that has not at all been a subject of discussion during the pandemic accord or agreement. We will not allow such, if ever such a discussion was to occur during the negotiation, I can assure you that we will not allow it to happen. As a matter of fact, when you look at the draft that is circulating, the draft pandemic accord agreement or instrument, on Article 3, Section 2, clearly on the principles, clearly stipulates and affirms the importance of the sovereignty of the countries, that it is the countries themselves that have the right over their people. I think that is very clear, Article 3, Section 2 of that. So I think the misinformation or disinformation is unfortunate. It's at all, the accord has absolutely nothing to do with the sovereignty of our country.
Thank you. And now that we have closed the chapter on the darkest days of the COVID-19 pandemic, we must dedicate our efforts to ensuring that the United States is leading the way, as you have identified as one of the biggest lessons learned, in preventing and preparing for the future public health threats, which requires an international response that will allow access, transparency, and data to contain an emergency virus in the host country with full cooperation of the host country in order to prevent it from spreading elsewhere. I think that should be our singular focus as a global community, wherever this virus may arise, even if it arises in the United States, to really have international cooperation to prevent, because that's how you're going to prevent the next pandemic. Thank you, and with that, I yield back.
Now recognize Ms. Malliotakis from New York.
Thank you. I'm sure you all know that the United States stands as one of the World Health Organization's top donors, contributing roughly $700 million in 2020 and 2021, with over 65% being voluntary above our membership dues. And in December 2021, the Biden administration announced another $280 million contribution aimed at ending COVID-19, bolstering health systems, and providing urgent relief. And as taxpayers, we want to make sure that our money is being used properly, that there are metrics in place, and that, as you say, we have a seat at the table. However, I'm really concerned about what we've seen from the WHO throughout the COVID-19 pandemic. I mean, they denied human-to-human spread of COVID-19 based solely on CCP propaganda. It was not until January of 23rd of 2020, the WHO finally recognized that human-to-human spread was occurring. It was a month after the first warnings. The WHO delayed naming COVID-19 a public health emergency. It delayed serious measures like travel restrictions because the CCP told them the spread was under control. The WHO continued to praise the Communist Chinese Party, failed efforts to combat the pandemic despite a globally recognized cover-up. And then when we pushed for an investigation into the origins, the CCP was given full veto power over inclusion of American scientists, right? The Communist Chinese vetoed the 3 Americans put forward by our government to be in that investigative body, and the CCP was given full power to edit and alter the final reports. And so I'm compelled to ask the question, I mean, how do you justify continuing U.S. support for the WHO given their debatable handling of COVID-19 investigations and apparent compliance with misleading Communist Chinese narratives? And I agree, the World Health Organization has played a tremendous role in the history. The United States was one of the founders. And when it came to the AIDS epidemic in particular and other, you know, they have been, but it seems to me that they're now corrupted by the Communist Chinese. So what do we do, and why should we continue to fund them if they continue to take their, if they continue to do what the Chinese tell them to do?
Well, thank you, Madam Congresswoman, for that question. Again, we really do appreciate being able to reflect on some of these very important lessons learned. With regards to our support of WHO, the leadership is very clear that we expect reforms with regards to the way they do business, and the U.S. has worked with WHO over time, particularly in the past several years, towards those types of reforms. You had Assistant Administrator Gawande mention the Standing Committee on Health Emergency Preparedness and Response. That committee was established by the Executive Board, on which we hold a seat, and the U.S. was supportive for the reasons that you described, particularly because we felt the board needed to have better oversight over WHO's response in emergencies and direct them accordingly.
Yeah, the issue is that even when we have a seat at the table, it doesn't mean that we're seeing actual reforms. And we have this problem with other international organizations as well. It's not just the World Health Organization. The fact that we have some of the most egregious violators of human rights sitting on the UN Human Rights Council, and that they're allowed to get away with it. I mean, it's a much larger issue of these global international organizations that have been infiltrated by these nefarious bad actors. You know, Iran chairing the UN Human Rights Council. I mean, that's disgraceful, okay? So this is just another example. I mean, the way that here we're seeing communist China having this much influence in the World Health Organization. So it's a much larger question. I guess my question to all of you is, what can we do as the United States other than send more American tax dollars to these organizations? What else can we do to truly reform them? Because what I hear from the administration is, oh, we've got to elect better actors to the committee. You know, that's why we went back to the UN Human Rights Council after, President Trump removed us, was because this administration felt, well, if we were at a seat at the table, we can get more better nations, democracies, freedom-loving people to be represented on those councils, but it has not happened. So what really can we do to change it?
Thank you. Let me provide additional information on what we are practically doing. We, the United States, are part of the Member States Task Force on strengthening WHO's budget, programmatic, and financial and governance. And as you've heard from us, I mean, there were about 96 actions that were required. And thanks to our leadership, our presence at the table, about 67 of those have been implemented. And we have about 25 or more that by the end of 2025 must be implemented. We are actively putting pressure where we believe it's producing the return on investment in terms of the actions that were required of WHO and what they are actually implementing.
Well, I appreciate that. It's yet to be seen whether any of this will really amount to anything other than nice words. But again, I run out of time, so I will yield back. But I think we just got to stop throwing good money after bad until we see some changes at these international institutions.